Good morning. So this is a little study that we did using a novel microneedling tip that actively can deliver compounds through the skin. So the question really is, how does it work? And is it any better than just a regular microneedling tip? And so we designed a little clinical trial to test this. Basically, we used human abdominoplasty skin. So this was a patient who was marked for an abdominoplasty. And so we used the surgical area to first do a little clinical trial. And we used this novel tip to try and deliver a variety of different compounds that might be clinically relevant. The first was just a liquid solution, and we chose tranexamic acid. We mixed it with some India ink so that we could visualize it later. And then we used a small particle hyaluronic acid, a large particle HA, polylactic acid, and calcium hydroxyapatite. Following the application of the needling with these substances, we took some biopsies and examined them histologically for qualitative analysis. So the first, it's basically a combination of these two tips. So there's the active method using this so-called cushion tip, where a pneumatic mechanical mechanism drives the products into the skin, versus a regular needle tip with 25 microneedles to it. Very briefly, this is the mechanism for this novel tip, where a vacuum and a suction is created so that when the needles insert and then withdraw, there's a negative pressure that sort of drives an air jet into the created channel, which theoretically can potentially improve penetration of topical substances that were placed on the surface previously. And this is the setup here, pretty simple stuff. The patient was marked for a variety of different test spots with the different substances. Each substance was done in duplicate, and a variety of different biopsies were taken at two different time points, one immediately after needling and then one 7 days later, just prior to abdominoplasty. The abdominoplasty was performed and this was all taken away. So the results, a couple questions. There have been some question as to whether or not microneedling can even deliver topical compounds, and so this was one thing that we wanted to look at. And then the other question was it different, with the active tip versus the passive tip? So what's the results? Well, it does seem like that the active delivery improves most of the substance penetrations, and also seem to result in a little bit greater retention at 7 days post. So as you can see here, with the assisted tip, we get a little bit deeper penetration of the tranexamic acid immediately after needling, and then a greater retention qualitatively 7 days later. And essentially everything followed that same pattern, except large particle hyaluronic acid, which was unable to penetrate in any situation. Here you see the small particle HAs, the pale blue amorphous kind of material in the channel, which was noted fairly obviously with the assisted tip, but with the passive tip we couldn't really see much. Under polarized light, you can see these little shards of polylactic acid within the channels. Similarly with the assisted, sort of showing it much more than the passive. And the reason we believe that the large particle HA couldn't penetrate was that the needle diameter is roughly 250 microns, and the particle size for the substance that we chose for large particle HA was over 500 microns, so physically it was just unable to penetrate the channel. So basically, it looks like that RF microneedling can produce functional channels for the purpose of assisted drug delivery. The extent of the channel and the degree of product penetration is likely due or dependent on physical properties of both the needle and the product. And it seems to be a little bit better than just using the passive mechanism of regular needling. Thank you very much.